Over 3 million athletes this year will experience some sort of a concussion, including professional, college, and high school student athletes. Hi, this is Hannah Lynn with StoneOakInfo.com. Now, a concussion is a form of traumatic brain injury where after a high-impact hit, tissues in the brain can stretch and bruise. 30% of football players, for example, will experience concussions on fields like this all over San Antonio. Now, since concussions cannot be seen on a standard X-ray, CT scan, or MRI, it is very difficult to properly diagnose the severity of the concussion. Until now. Dr. Evan Ratner at Impact Urgent Care is one of the only physicians in San Antonio certified to administer a concussion management test called IMPACT, or Immediate Post-Concussion Assessment and Cognitive Testing, and says it's something that every athlete should be aware of.
About 10% of any given high school football team is going to suffer a concussion every season. That's 1 in 10. If your child plays football for 4 years in high school, there is a 30% chance that he will suffer a concussion. And the concussions are not just limited to football. Cheerleading is a top 5 sport for concussion. The baseline concussion test is a completely non-invasive test that takes a snapshot of someone's brain function. And typically we would use it before the season starts. So it's really a very sophisticated neurocognitive test, but it's dressed up like a very simple video game. This test can be potentially life-saving in helping us to identify when the concussion is resolved. So from the pure medical aspect of it, we're talking about no risk, huge benefit, and almost no cost, which in my mind is a no-brainer.
The IMPACT test evaluates the brain and cognitive activity, including reaction time, brain processing speed, memory, and delayed memory, all by the click of a mouse. It's just like a video game and only takes about 20 minutes for the athlete to complete. And according to Dr. Ratner, this $15 test is imperative for every athlete to take before the possibility of a concussion.
By far, the best medical information for us is to have the test done before there's an injury. So if every athlete gets this done before the season, and if they get an injury, we have the best information possible to take care of them the best way possible.
As a collegiate cheerleader myself, I decided to take the IMPACT test just to be on the safe side. And in case I get a concussion, I asked Dr. Ratner what the next step would be.
If a student athlete is suspected of having an injury or a concussion, then within 24 to 48 hours, they need to be brought back to Impact Urgent Care. At that time, we'll examine them, we'll get a good history and a physical examination with a very focused neurologic examination. And then we will retest them using the same neurocognitive test. And we compare the results of the baseline with the post-injury. And the differences that show up are very sensitive, they're very reproducible. They help us to determine the extent of the concussion, and almost more importantly, they help us determine when that athlete is back to their baseline.
The aftermath of a concussion can be devastating, and having the IMPACT test on file can be a vital piece for anyone's recovery. To schedule a concussion baseline assessment appointment with Dr. Ratner, call Impact Urgent Care at 210-493-HELP.